This is how to perform a left or right Dix Hallpike in the TRV chair. First, move the patient into the correct position by pulling the plunger above the patient's head. Rotate the chair into the desired angle and release the plunger to lock it in place. For a left Dix Hallpike, move the chair so that the left D-shaped handle is parallel with the back of the chair. For a right Dix Hallpike, move the chair so the right D-shaped handle is parallel with the back of the chair. When the patient is in the correct position for either left or right Dix Hallpike, you can start the test. Unlock the chair by pressing the foot switch. Observe that the green light is on. Use the top handle of the chair to move the patient into the Dix Hallpike test position, 45 degrees below horizontal. Lock the chair in position with the foot switch and observe for nystagmus for a minimum of 60 seconds. Unlock the chair again and bring the patient back to a vertical position. Hold this position for at least 60 seconds while observing for nystagmus.